Hi friends, in this video I will talk about burnout among doctors and how can we cope with it. First is the disclaimer. Caring Docs YouTube channel does not provide medical advice. Information available on this channel does not offer diagnosis or advice regarding the treatment. Information provided by this channel is for educational purpose only. It should not be used as an alternative to healthcare professionals' diagnosis or treatment of any person or animal. Please seek the help of medical expert for diagnosis, prevention, and treatment of medical illnesses. There is no endorsement for any brand or a company. What is burnout? It is exhaustion of physical or emotional strength and motivation, usually as a result of prolonged stress or frustration. WHO defines burnout as a syndrome conceptualized from the chronic workplace stress that has not been successfully managed. The components of burnout are emotional exhaustion or loss of passion for one's work, depersonalization or treating the patients as objects, and sense that your work is no longer meaningful. Is workout really a problem in doctors? The higher suicide rates in the doctors are proof enough. Doctors and their healthcare workers come in the highest risk group for this problem. Dealing with the pain of lot of people takes its a toll. Are doctors just depressed or is that burnout? There are two types of depression, colloquial and clinical. Colloquial is it refers to the feeling down, blue or sad. Clinical it is when it is prolonged, severe depression that is not caused by normal grief associated events. What are the challenge which affects doctors' well-being? First is the burnout. 44% of the doctors they experience the burnout in their routine work. Stress contribute 60% of the doctors they feel stressed. A long working hours like 50 to 60% of the work and when that too more than 50 hours a week all that contribute to burnout and lack of autonomy it also contributes to the doctor's burnout. Why are we talking about it? Is it important? Yes, because nowadays there are electronic health record. It is another type of burden which doctor face because we are not habituated with these new electronic gadgets, new record keeping electronic health records, and that unduly creates a stress. Bureaucratic tasks, patient safety concern, limited resources, poor work-life balance, stigma around the seeking mental health supports. Even if doctors who feel stressed out or who feel depressed or some have some mental issues, they hesitate to consult a psychiatrist or psychologist for their own grief. The various causes of burnout in Indian doctors are long working hours, often exceeding 12 hours a day, heavy patient load, and overcrowded hospitals, limited resources and infrastructure, bureaucratic tasks and administrative burdens, constant exposure to infectious disease and risk of contracting the illnesses, high stakes decision making with limited support, limited autonomy and control over the practice, poor work life balance and lack of personal time, stigma and social pressure to perform, limited opportunities for professionals' growth and development. The prevalence of doctors' burnout. A 2020 study by Indian Medical Association found that 75% of doctors in India they reported feeling burned out. In 2019, American Medical Association revealed that 44% of the doctors in the US they experienced the burnout. A 2018 study published in the Journal of Royal Society of Medicine reported that 60% of the UK doctors they felt burned out. The burning out by the doctors leads to bad consequences in the form of medical errors, impaired professionalism, reduced patient satisfaction, staff turnover, and reduced R, depression and suicidal ideation, motor vehicle crashes or near misses, active and passive errors. What are the emotional signs of burnout? There are detachment, loss of enthusiasm, motivation, irritability, mood swings, cynicisms, anxiety, depression, feeling of overwhelmed, hopeless, reduced empathy and compassion. These are the emotional signs of burnout. The various physical signs of burnout are it is very important to recognize the physical signs in self-awareness or there should introspection should be done regarding the acknowledgement of the physical, emotional, and behavioral changes. The physical signs are chronic fatigue, exhaustion, insomnia, sleep disturbances, headache, migraines, muscle tension, pain, gastrointestinal issues, and weight changes. The behavioral signs are withdrawal from the social interaction, procrastination, avoidance, increased absenteeism, tardiness, substance abuse, addiction, changes in appetite, eating habits, loss of interest in activities. Are the behavioral changes which occurs and which make us realize that we are suffering from burnout. The various self-reflection questions which we should ask are we constantly feeling exhausted or drained? Do we lack motivation, enthusiasm for work or activities? Are you experiencing increased stress or anxiety? Are you withdrawing from the social interactions, relationship? Do you feel hopeless or overwhelmed? Have you noticed changes in your physical health? All these questions should be asked by ourselves. Now the question is burnout measurable? The answer is yes. We have a Maslach burnout inventory. This is MBI tool which assesses the three components. These are emotional exhaustion, depersonalization, reduced personal accomplishment. And there are 22 items which are divided in three subscales rated on a scale of 0 to 6 frequency scale. We have other scale also MBI human service survey, MBI educator survey, MBI general survey. Other measuring tools are burnout self-test, professional quality of life scale, burnout assessment tool, and Copenhagen burnout inventory. So we usually use the MBI scale, that is Maslach burnout inventory tool. Here we assess emotional exhaustion, depersonalization, reduced personal accomplishment, and we usually score from 0 to 5. 0 is when we 0 is for when we never encountered some sort of symptoms, 1 is rarely, 2 is sometimes, 3 is often, 4 is very often, and 5 is almost always. Depersonalization includes 5 questions. First question is I feel I have more callous towards people since I started this job. Second is so we have to if the answer is never we will score it as 0. If answer is rarely we will score it as 1 and similarly sometime often very often almost always we can answer this question or we can label it as numbered from 0 to 5. Similarly, the second item is I feel I have become less sympathetic towards people since I started this job. We have to number it from 0 to 5. Third is I feel I am treating the people as if they are impersonal objects. I feel I am losing the concern I used to have for my work. I feel I am no longer able to provide the kind of care I used to. So, for every uh, item, we have to give the score as 0 to 5. In emotional exhaustion, we have 9 items, and again, we have to give the answer as 0 to 5. First is I feel emotionally drained from my work. I feel tired when I get up in the morning and have to face another day of work. I feel exhausted at the end of my work. I feel fatigued when I have to work with people of all day. I feel I am working too hard on my job. I feel my work is emotionally taxing. I feel my job is making me feel burned out. I feel depleted of my emotional energy. I feel I am at the end of my hope. So we have to answer each item from the 0 to 5. Sorry. Next is reduced personal accomplishment. It includes 8 items. I feel I am not doing my job as well as I used to. I feel I am not achieving that what I should. I feel my work doesn't make a difference. I feel I am not making a progress in my work. I feel I am not handling my workload effectively. I feel I am not doing work that is meaningful. I feel I am not contributing to the organization. I feel my skills are not being utilized. So, for each item, we have to number it as 0 to 5 as per our feelings. So, how do we interpret these results? We have to calculate the subscale score by averaging the items rating. For example, if emotional exhaustion, if the score is 0 to 2.9, we we will label it as low emotional exhaustion. Moderate is 3 to 4.9, and high is 5 to 6. For depersonalization, low is 0 to 2.4, moderate is 2.5 to 4.5, oh sorry 4.4, and high is 4.5 to 6. For reduced personal accomplishment, low score is 0 to 2.9, moderate score is 3 to 4.9, high score is 5 to 6. So when we will add all these subscale, if we get uh, low burnout scale score will be 0 to 14, moderate burnout score will be 15 to 29, and high burnout score would be 30 to 42. So once we have calculated the burn score, what we have to do now? We have to acknowledge and accept our burnout. We have to seek the support from colleagues, friends, family. We have to prioritize self care and relaxation. We have to set boundaries, and we should always learn to say no. We have to re-evaluate our priorities, values. We have to consider professional help and counseling if required. The various preventive strategies are regular exercises, physical activity, mindfulness, meditation practice, healthy eating, sleep habits, social connections, networking, time management, prioritization, regular breaks, self care activities. These are all activities which will help us to manage the burnout. The various mitigation strategies are we have to attend some wellness programs, self care initiatives has to be taken. We have to be flexible scheduling and workload management. We should get peer support and mentorship. We have to mm, adopt mindfulness and stress reduction trainings. We have to improve the communication and teamwork. We have to show recognition and rewards for excellence. The policy changes to reduce the administrative burdens is also a necessity nowadays. Better stress management by doctors through deep breathing exercises, progressive muscle relaxations, journaling or reflective writing, connecting with the nature, mindfulness meditation, seeking social support, physical exercises like walking, jogging, and prioritizing the sleep and self care. The doctor's well being can be promoted by programs, mindfulness and self care training, peer support groups, mental health resources, flexible scheduling, recognition and rewards, efficient emergency health record system, streamlining the administrative tasks, leadership support, and open communication. Various digital tools which are helpful for doctors are Headspace, that is mindfulness app, Calm meditation app, Doctor's Companion mental health app, Medscape's doctor lifestyle, and Happiness Report, Happiness Project online community. Doctors can join these online community to de-stress their self. The various comprehensive plan which can be taken to tackle the burnout are at individual level, organization level, and leadership level. At individual level, doctor has to adopt self-care practices like regular exercises, meditation and mindfulness, relaxation techniques like deep breathing, yoga, boundary setting. He has to prioritize his tasks. He has to learn to say no. He has to set realistic goals, establish work and life balance. The various organization level methods which can help him to cope up with the burnout is the wellness initiatives. Various organizations can hold various employees wellness programs, mental health resources, fitness classes, healthy snacks options, flexible work arrangements will definitely improve the doctor's burnout by telecommuting, flexible schedules, job sharing, compressed worksheets, work weeks. The various leadership level lead by example demonstrating the self-care practices, prioritizing the work-life balance, encouraging the open communication, foster a supportive culture, promote teamwork, encourage collaboration, recognizing and rewarding the employees, providing the resources for burnout prevention, monitoring the workload and performance, regular assessment workload, provide feedback and coaching, address performance issues promptly, various developing the burnout prevention policies like establish clear expectation, provide resources for burnout prevention, monitoring and addressing the burnout. All these are the levels which, if taken by the doctor himself or his organization, they will definitely help the they will definitely help the doctors to cope up with their burnout. So they have to identify whether they are burnout or not by physical science, emotional science, behavioral science, and this is the burnout scale through which they can categorize themselves into various grades of the burnout, and simultaneously they can ask for help. Louis Pasteur has said, chances favors the prepared mind. With this, I conclude my today's topic. Thank you. Keep learning.